Good evening. We're going to talk about protection and movement. Mobility refers to the purposeful movement of physical activity, includes gross and simple movements, fine and complex movements, as well as coordination. Functional mobility is deemed adequate when the maximum movement independence is achieved to meet the person's activities of daily living. Impaired mobility may be the result of multiple health complications or psychosocial maladaptations, such as depression or anxiety or some kind of combination. Populations at highest risk include increased age, military, socioeconomic factors that might affect their ability to access mobility aids or resources. And then cultural, personal choices and cultural factors can also influence activity levels and mobility. Expectations, for example, that seniors should avoid strenuous activities. Lifestyle factors such as an individual's interpersonal relationships, learned coping mechanisms, and alterations in mood can affect mobility. Medical disorders such as a patient with trauma or musculoskeletal tissue damage, central or peripheral nervous system damage, cardiopulmonary perfusion, gas exchange, heart failure, and then congenital deformities that can affect multiple body systems. And then people can have multiple comorbidities. So all of these things mixed together. And then some treatments also affect mobility, such as sitting in a dialysis chair for 4 hours. So it's expected that you're going to complete the background information as a reminder of A&P and Patho prior to coming to class. These video casts or podcasts will help you participate in class. Content in these recordings are testable. Muscles, for example, we're going to start there, are contractile tissues that are comprised of fibers that are going to shorten in response to a stimuli. Connective tissues is a broad term, and it includes bones, bursa, cartilage, fascia, ligaments, and tendons. The purpose and function of the musculoskeletal system is to protect organs, provide support and stability, store minerals, blood cell production, and allow for coordinated movement in combination with the brain. Now, there are three muscle types. So let's talk about the connective tissue. The cardiac muscle you'll focus mostly on in level 4. It is a striated muscle. It's only found in the heart, and it allows this muscle to create spontaneous contraction. Smooth muscle, over here on the far right side, is an involuntary non-striated muscle, and contraction of smooth muscle is controlled by neurons as well as hormones. And then skeletal muscles are striated muscles that account for half of our body's weight. It does require brain or neuron stimulation for contraction. And then there are three types of cells: osteoblasts, which are bone-forming cells, osteoclasts, which break down bone tissue, and osteocytes, which are mature bone cells. In the microscopic picture, this is the basis for bone remodeling and removal of old bone tissue. And then in our body, we have 206 skeletal bones in normal conditions. There are 5 types of bones, which include the long, the short, the flat, the irregular, and the seismoid. If you want a very short video, I think it's like 7 minutes, go to this visiblebody.com, learn skeleton and types of bones to review. Bursa, or types of bursitis. Bursa are these small gel-filled sacs, and they're located near joints throughout the body. And they're positioned between the bones and the soft tissue to help reduce friction as we move. Bursitis is a painful condition when there is swelling of that small fluid-filled sac. And you want to think of bursa, like the plural of bursa, as tiny cushions that protect spaces around the bones and other tissues. And these sacs work like bubble wrap. It offers protection to various structures throughout the body. They're strategically placed between bones and muscles, tendons, and skin to reduce friction of movement. Bursitis occurs when one of these bursa become irritated and then swells, and then that inflammation can affect other bursa. It can develop significant discomfort, and with that pain may develop suddenly or gradually over time. The most common causes of bursitis include overuse or applying too much pressure to a bursa, whether it's through repetitive motions or prolonged pressure. Understanding how bursitis develops is crucial for finding relief and preventing future episodes. Cartilage is another connective tissue. Now, cartilage serves as a barrier for bones and joints, and it protects that articular surface of the bones and provides padding for your joints. It is the function of cartilage to work as a shock absorber for bones and joints. Cartilage also helps make regular motions pain-free, making everyday activities more comfortable. And what it does is it disperses the impact of energy and lowers that load on the skeleton. Imagine the difference between doing some jumping jacks in bare feet and wearing a pair of running shoes. Cartilage provides that shock absorption just like a good pair of sneakers. Reducing friction and supporting structures in the body is the cartilage. So there are three types of cartilage: elastic cartilage, and it's the most flexible. It provides support to parts of our body that must bend and move in order to function. And even after a strong force, elastic cartilage can return to its original shape. Your ear is made of flexible cartilage. It's pliable, it can be bent, it can be reshaped without breaking or injuring the user. Elastic cartilage is a type of cartilage that can be found in not only our outer ears, but also the eustachian tubes, the larynx, and the epiglottis. And these all allow for the body to move. Hyaline cartilage is the second type of cartilage, and this cartilage covers most of the ends of the bones and acts as a lining for joints. And bone ends are lined by hyaline cartilage, or articular cartilage is another name for it. Because of its slippery and smooth nature, hyaline cartilage facilitates the free movements of bones within a joint. It can be bent without breaking, and it is sturdy enough to keep the joints from deforming. Hyaline cartilage, though, is slick and smooth, and it allows the bones to glide past each other. It's flexible, but it's robust enough to keep the joints in place. The last type of cartilage is fibrocartilage, or fibrous cartilage. And it's exactly what the name implies. It's very thick, it's very tough, it's the most powerful, and it's the least flexible of all three cartilages. And it keeps most of our body components in place, and it cushions us as we fall. So fibrocartilage location is in the knee's meniscus, in the discs that sit between the vertebrae in our spine, and also in muscles, tendons, and ligaments throughout the body. Now, there are 6 types of joints, and the joint is a junction between 2 or more bones and the cartilage. And we broadly divide these joints into 3 main categories: immovable joints, slightly semi-movable joints, and freely movable joints. The most common of the joints in the body are those characterized by what we call synovial joints. And these are fluid-filled sacs, and they're filled with synovial fluid. There's a joint capsule, and there is articular cartilage. So you're going to see pivot joints like in the neck, saddle joints like in our fingers, plane joints like between our ankle and our feet, ball and socket joints like in our hip, condyloid joints like in our wrist, and hinge joints like in our elbows. The other type of joint is in our brain. And I bring this up. There's 4 main cranial sutures. This part you do not have to memorize. But what I want you to remember, and this will be important in level 4, somewhat important in level 3, is that the infant posterior fontanelle closes within 2 months of birth. It's smaller than the anterior fontanelle. But within 2 months, this back portion is solidified and these sutures come to a close back here on the posterior part of the skull. The anterior fontanelle won't close until that baby's closer to 18 months to 2 years. Now, this is in a normal infant. If there's something like too much CSF, which is a term called hydrocephalus, then up until 2 months, their brain is still growing and that fluid is still growing and those sutures are not closed. And so that head can expand. But if you get an adult patient with hydrocephalus, then they are unable to expand their skull to accommodate that increased CSF. Very important concept. So posterior fontanelle closes within 2 months, anterior fontanelle closes by 18 months. And then the fascia. Fascia is another connective tissue. And what they've discovered is that it surrounds all cells, nerves, joints, tendons, and ligaments in the body. At first, it was thought only to cover just below the skin and over the muscle. But what they realized is that it supports tissues and organs, and it really lessens friction that muscles might encounter during movement. And it eases some of that muscle tension that helps us to move. Reflexively to help us move, while the more muscles shorten up to help us move. Our fascia is happy when it's slippery and smooth and it stretches as you move. If it's not doing well, it can get thicker and stickier and drier and tighter, and that can create a problem. There are several layers to the fascia. There's a superficial layer, which sits right underneath the skin, and it's thicker than most of the other fascias when it's in the stomach and the chest, but it gets thinner as it gets away from our core or away from our center. And then deep fascia covers bones, muscles, nerves, and blood vessels. And this can be broken into two further types. So the aponeurotic fascia, it's thicker and it separates more easily from the muscles. And then there's the epismal fascia, which is thinner and more tightly connected to the muscles. These two muscle fascias are going to be important when we start talking about fractures and compartment syndrome. And then visceral fascia is the layer that goes around certain organs that settle into the body's open spaces, like the lungs, the heart, and the stomach. Parietal fascia is tissues that line the body cavities called the parietal fascia. For example, our pelvis is lined by parietal fascia. Pain in the fascia is commonly mistaken for muscle pain or joint pain. Now remember this. The biggest difference is that muscle and joint pain get worse as we keep moving, while fascia pain gets better with movement and with heat. So huge importance. And then the last two connective tissues are tendons and ligaments. Tendons and ligaments both have a very poor blood supply, and as a result, they don't heal as well when they are damaged. The tendon has a little bit better luck with healing only because it relies on synovial fluid diffusion to provide some nutrition. But the ligaments are fibrous tissue, and the ligaments connect bone to bone and very slow to heal after a ligament injury. We're going to talk about ligamentous injuries when we talk about spinal cords. And then your tendons connect muscle to bone. And the longest, most important tendon in our body is this Achilles tendon, which connects the two calf muscles into the calcaneus. All right, so bring your questions to class, and part 2 in the next video will be a review of neuro and its role in movement.